Have you been with, Mr. Chapman? I haven't counted just yet. Do we have a quorum present?
Yes.
All right, thank you very much. I'll call this meeting to order of the Operations Committee. It's 5:32, September 1st. We'll start with roll call. Mr. Salgado.
Present.
Mr. Arena. I see Paul. I didn't hear him. I see him.
Here.
Thank you, sir. Ms. Red.
Present.
Mr. Hoffman. Mr. Bucita. Ms. Crosby. And I am also present. 1, 2, 3. Yep, we've got a quorum. Thank you very much. Can I have a motion to approve the minutes from April 6, June 18, and July 2nd, 2020?
I so move.
Mr. Scott moves, seconded by Mr. Arena. All those in favor signify by saying aye.
Aye.
Anybody opposed? We have approved the minutes. Now we're getting weird. Mr. Chapman or Mr. Thompson, do we have anybody to sign up this evening for public comment?
No.
Okay, I shall omit that portion then. Item E, resolution establishing the date, time, and locations of each meeting of the Winnebago County Board, and I so move. Can I have a second?
Second by Mr. Salgado.
Salgado seconds it. The items before us. This is, Mr. Chapman, do you want to speak to this? Just kind of housekeeping, establishing dates and times as it says.
Right. We're required by law to establish the meeting dates and that prior to the end of our fiscal year. This falls in line with the second and fourth Thursdays with certain exceptions based on holidays. First of all, the November second meeting would be on the first, or actually on the fourth Tuesday rather than the fourth Thursday, because that's Thanksgiving. This year we've added an organizational meeting, which would be on December 7th, which would be the first Monday, which is follows what the state law requires. In December, we have our second meeting on the fourth Tuesday, because the fourth Thursday would be Christmas Eve. And then in September, the second meeting would be the fifth Thursday as opposed to the fourth Thursday. We need 15 days for the budget to lay over. So those are the exceptions.
Thank you, Mr. Chairman. Pretty similar to what we did this year. Are there any questions about the this resolution? Seeing none, I'll let the record reflect Mr. Bucita is now with us as well. Mr. Bucita, we're just voting on establishing the date, time, and locations of each meeting. All those in favor signify by saying aye. Aye.
Aye.
Is there anybody opposed? Resolution passes. Moving on to the next item is resolution authorizing fire alarm signal monitoring and lease services agreement. And I so move. Can I have a second, please?
Second.
Second by Mr. Salgado. The item is before us. Mr. Chapman, can you fill us in on this?
I would defer to Ms. Johns, who's on the phone. She's the one that's been involved with this in the past.
Excellent. Ms. Johns.
Hi, good evening. Thank you, Chairman. This has been a project that's been in the works for over a year and a half. So I'm very pleased that this is coming forward now. The way the system now is, each of our buildings, with just a couple of exceptions, are hardwired with what they call copper lines run by AT&T from, let's say, River Bluff to the number one fire station in downtown. And that's how our fire alarm monitoring is handled. It's handled direct through that. Well, the city has elected to get away from that because that's also how they have their buildings wired. And it's very costly because those phone bill goes up. At River Bluff, for example, we pay $1,100 a month for just that one fire alarm phone line, that copper line. So the city has come up with this program and they've implemented it in their buildings. And now if you look at Exhibit A, you'll see all of our buildings that will be under this new program. It's going to cost us $65 a month, and that includes the wireless phone router that they're going to use. I want to call it the right word, wireless radio, I guess they call it, and the service. So $65 a month versus $1,100 a month for one of our buildings. And that's about it. And we can get out of the contract at any time. Dave Kerlinkus was kind enough to review everything for me. We also worked with the city attorney to get the language just right. And the only exception is going to be Memorial Hall because they have fire alarm and they also have burglar alarm on the same service. So that's about it.
Thank you, Ms. Jones. And I know that the Fire Protection District, of which I was a member last year, they made the same switch and it saved significant amount of money. I'm glad you identified the cost savings and I'm glad we're moving in this direction. Is there any questions about this alarm monitoring? Seeing none, all those in favor signify by saying aye.
Aye.
Is there anybody opposed to this? The ayes have it. Are there any other matters for the Operations Committee? Seeing none, how about a motion to adjourn?
So move.
Mr. Salgado, seconded by Mr. Bucci. All those in favor signify by saying aye.
Aye.
Is there anybody opposed? We are adjourned. I apologize for being a couple minutes late. Like I said, I was busy.
Not a problem. Thank you.
Thank you, guys. I don't think public safety was ready for us to be done in 8 minutes.
Yeah, I don't think we've got a quorum yet.
Mr. Fellers, you always have those great backgrounds.
Oh, this is
I always look forward to seeing what you have up. What do you have up
the way it
tonight?
usually is. This is the way it usually is because this is my work. This is my workstation all day long.
Oh, okay.
Yeah, the corporate world has moved away after like the first 5 months. Everyone stopped using these backgrounds, and you got to create your own space behind you.
Oh, okay.
I'm still working on it. Let's see what I've got loaded up today. I've got a few good ones in there. There we go.
Oh, I like that. Very calming.
Exactly. Oh. Yeah, that's the nice thing. You can always just kind of put your mood behind you, you know.
That can sometimes be an important life lesson. Put your mood behind you, move forward.
That's right. That's right. Oh, here we go. All right. I can at least pretend I'm on the 8th floor.
That really looks like you're on the 8th floor.
I need to move my green screen. I rearranged my office and it's sitting in another part of the room. I've got to figure out how to mount it to the ceiling.
Hey, Mr. Salgado, you still listening? State's Attorney Height Ross,
Yes, Mr. McDonald.
would you be willing to call me this evening after this for a 3-minute conversation?
Absolutely.
Thank you.
You want to send me your number in the chat to me only, because I don't know that I have an after hours number for you.
You know what? I can give it to you just right here because it's on the website and everything, and anybody who wants it's got it.
Oh, okay, sure.
It's 815-222-4407.
Okay, all right, got it. I'll give you a call after the meeting.
I thank you, and I promise I'll keep it less than 3 minutes.
You're welcome. My day never ends at 5. People say, what's your work day? I said, the day, including 7 days. So it's not a problem at all.
And also the night. I mean, it's,
And
it's
the
the-
night, yes,
It's the day and the night.
The day and the night, so
Thank you very much.
you're welcome.
We have a quorum. Has anyone contacted Mr. Booker to see?
Do we have a quorum?
Looks
Yeah.
like Mr. Booker, I see his icon popping up. He might be on in just a second.
Oh, there he is. Yeah,
Yeah.
okay.
I think
All right.
we have a
Good.
quorum. I think we're ready to go.
Okay.
Can anyone hear me?
Hear
Yep.
you now.
Okay, you just can't see me, I guess, huh? Huh.
That's why I like this meeting. I can't even see you.
Yeah.
You
I don't
might
know
not
why.
even have pants on.
We have a quorum, Mr. Booker, so
Well, I thought we were gonna do operations before
uh,
public safety.
that's
They're
already
done.
already done. Yep.
Wait, I'm sorry, there was about 3 people speaking. What was that?
We're already done with operations, so we can get started.
Okay. Well, thank you. That's nice to know. All right. I guess we'll take a roll call. So I got Mr. Fellers,
Here.
Mr. Arena,
Here.
Miss Red,
Present.
and I don't see Mr. Westcott, and Mr. Zintak is unable to make it. Okay. 1, 2, 3, 4. We do have a quorum. So,
I think Mrs.
Okay.
Gorel was on. Angie Gorel was on.
oh yeah. Yeah, Miss Gorel?
Wait a minute here. Now, can you hear me?
Yes, very good. Thank you, Ms. Gorel.
Thank you. Sometimes you have to tell me to
Is there-
turn off the mute.
Is there anyone from the public that would like to address the Public Safety Committee meeting?
We have no one.
All right, seeing none, we can move on to the next item. And if everyone would just bear with me, I just walked in the door, literally just walked in the door from work. So I know we have a resolution for Rosecrans. Is there any other items on the agenda?
Yes, you have one for a resolution awarding bids to county towing service.
Okay, I'm still getting, hold on. Okay. Thanks for bearing with me, everyone. I apologize for the delay, but just still setting my stuff down. And as I said, the next item on the agenda is a resolution authorizing funding for the Rosecrans Crisis Triage Program. Can I get a motion?
So moved.
Second.
Motion by Mr. Fellers and a second by Ms. Gorel. Is there any discussion? I would like to add that Mr. Chapman and I spoke about this last week, and jump in when you can, Mr. Chapman, but it's an item that's already been budgeted. And it was just something that Mr. Chapman felt that would be a really good idea that we establish this in a resolution. But it's been budgeted. It's something we've done for a while. So Mr. Chapman, if you would like to elaborate, I'd appreciate it, sir.
Thank you, Mr. Chairman. You're correct. This was incorporated into the 2020 budget and would be paid out of that particular budget. Mr. Stallings from Rosecrans is at the meeting. If you would like him to address the services that are provided, Mr. Chairman.
Yes, I would like, Mr. Stallings, I saw you earlier. It looks like you've jumped off the screen. There you are. Hello, sir. Thank you very much for joining us. And I would appreciate, I think the committee would appreciate some input from you, sir. Go ahead.
Yes, sir. Can everybody hear me okay? Okay. Thank you, Mr. Chairman. Good evening, everyone. My name is Craig Stallings. I serve as one of the regional vice presidents of operations for Rosecrans. And we're here just to talk just a little bit about our triage services. And so I'll just jump right into it. As you recall, the triage service program provided by Rosecrans was created in 2012 in response to the closing of Singer Mental Health and funded primarily by a grant from the Illinois Department of Human Services and Division of Mental Health, which then they subsequently stopped all funding for us. As some funding has been able to roll in, we still function at a deficit. roughly about a $300,000 deficit to provide these services. Our triage division is kind of often viewed as a behavioral health emergency room, which is a central point of entry for individuals in psychiatric crisis, and is in operation 24 hours a day, 7 days a week. Some of the essential functions of the triage center is to provide evidence-based evaluation, assessment, and crisis stabilization services, to determine the nature and severity of the presenting mental health problem, and also to determine the least restrictive level of care for the individuals and what they may need. We also conduct risk assessments to determine if the client is at risk to themselves or to others in the community. We also try to streamline the engagement process for those individuals with psychiatric needs by expediting the process of assessment and referral with a structured care plan and access to the community, access to services at our community mental health center. And the design of the triage center is what we would call a community living room model, which is really designed to provide a comforting atmosphere for assessment and stabilization. In the triage center, there would be comfortable lounge chairs, a nutrition center where snacks are available, a shower, and laundry services. Oftentimes, those are the immediate needs that need to be met before we can engage the client to really take a look at some of their issues. We have mental health evaluators who work out at Triage Center and provide on-site or mobile assessments for those individuals experiencing a psychiatric crisis, as well as placement for those needs. The triage staff works closely with local emergency departments, local law enforcement, and first responders for referral and linkage to triage as an acute care alternative. We help to deflect patients from higher cost emergency rooms and hospital visits and divert patients from the criminal justice system to more appropriate levels of care. We also see the triage center as a time-saving and resource-saving alternative. We pride ourselves on the police having to bring an individual in that they spend 10 minutes, less than 10 minutes, they're in and out to get those individual services, and they can get back on the streets and provide the services that they do. As a part of, again, as an example of some of the community benefit, we've been partnering with the Rockford Fire Department and received approval from the Illinois Department of Public Health to allow fire personnel to bring individuals with mental health concerns directly to the triage program rather than a hospital emergency room. It's kind of a complicated process, but it really allows for those individuals who really need mental health services, primary mental health services, to come directly to the triage instead of to the hospital and then the triage. Also, I have to relate one of the stories that Captain Owens gave us, that a gentleman in a wheelchair presented at the jail, or was he, I guess, being processed jail, clearly was presenting some mental health crisis. And literally the staff wheeled him down to the crisis center, and we got him admitted and provided services on the spot immediately. So I think that's kind of an example of just how quick and easy that process can happen. I'd say that the vast majority of the 1,000+ clients that we see per year probably go home within 23 hours. And probably about 60% of those follow up with aftercare services at our outpatient, mental health outpatient programs. Others are seamlessly moved to short stays in our adjacent 16-bed crisis residential program with the average length of stay of 7 to 10 days there. And only about 15 to 20% of individuals are referred out for primary health care or acute psychiatric hospitalization. As we spoke a little bit earlier regarding funding, due to our overall size, our Rosecrans did not meet the criteria for the PPP loans. And so with the ever-changing staffing patterns and individuals going out, it's been quite challenging for us to adjust to those needs and still provide the services, much like everybody else in the county, I'm sure. So again, I kind of humbly ask to support the $85,000 sustaining operational support for us. Again, I think it's a much needed service and has proved to be quite useful within the community. With that, I'd be happy to answer any questions.
Mr. Chairman, may I speak?
Ms. Gorel and then Mr. Kelly. Go
When
ahead.
we first started this, when Rosecrans ran into this trouble, the state had also cut back their funding. The first couple of years, we were giving them $100,000 a year. Now it's down to 85. I'm real pleased to see that we have had others to come in and help reduce the cost of what the actual cost is overall. It's been such a benefit to our community that people keep talking about Singer. People should be talking about our triage center. And if you're new to the county, you might want to know that it's on the corner of, I believe it's Park Avenue, Mulberry. It's on the corner of Mulberry and North Winnebago. Wonderful facility, and thank you for having it there because that keeps them out of the waiting rooms of our hospitals. It cuts way back on additional cost. So it's one of the most worthwhile things we have invested in. Thank you.
Thank you, Ms. Gorel. Yeah, I agree. The cuts have been unfortunate, and it is so nice to have Rosecrans that have been standing in there for us. And with the closure of Singer Mental Health, that was a real, it was a big hurt to the county, and Rosecrans has been there all the time. And to have our jail staff commend and look to Rosecrans, it's really been a big help. Mr. Kelly, yes, sir, go ahead.
Thank you, Chairman. I wholly agree. The triage center is absolutely essential. I'm just thinking we just passed a mental health tax, and shouldn't this be going in front of our new mental health board?
Perhaps we should wait about a year or so until they build up a budget, not a budget, they build up an escrow where they might have monies to do this. Don't know until we get to that point.
That's a good topic of discussion. We have State's Attorney, Ms. Hite Ross. Glad to hear from you. Go ahead, ma'am.
Thank you, Mr. Chairman. I just want to reiterate what the spokesperson has said from Rosecrans. This is an absolute necessary assistance to law enforcement in our area because they are available when law enforcement needs them to most to help individuals that are in a mental health crisis, and the first responders are the ones that are called. And so this triage center that Rosecrans has had is invaluable to support law enforcement to our community. And I just want to share with you, about a year and a half ago, I did attend a conference in the Capitol, and some of my colleagues and I spoke to some of the federal representatives regarding how important it is for them to send funding for centers such as what Rosecrans provides into local communities. And not everyone in Illinois has a center like Rosecrans, but it is much needed to assist individuals that are in a mental health crisis and do not belong in the ER or in the local county jail. So I just wanted to share that with everyone and then thank Rosecrans for their presentation. But we certainly are ahead of the curve in supporting Rosecrans for all these years with the triage center. Thank you, Mr. Chairman.
Thank you, Ms. Hite Ross. Mr. Arena.
Thank you, Mr. Chairman. I see in the resolution, it talks about partnering with local municipalities. So who else is contributing to this? And approximately how much is everyone giving an equal share? I also see in the letter that was attached here, it mentions Boone County uses these services as well. So are they also contributing?
Mr. Stallings, go ahead, sir.
Okay, sorry, I was still on mute. Actually, I don't have that information with me at this moment, but I can certainly get it. We're definitely in different stages of ask, if you will. So we haven't secured funds from all entities. We've also been reaching out to the local hospitals as well as to help support and ongoing operational support there as well. but I can certainly get that information and bring it to you. Send it to you.
Are you aware of anyone else who's committed to support at this time?
Definitely, OSF St. Anthony Hospital has been, we have services contracted with them. We have a relationship with Swedish American Hospital. I just don't have the exact dollar amounts with me.
I guess I'm more interested in what other units of government are.
Okay. I'm sorry, I don't have that at this present time.
I agree with Mr. Arena that with all the agencies that we have within Winnebago County that come to our jail, they have mental health and addiction inmates that come in as well. So yeah, that's a good question. I agree with Mr. Arena that I'd like to see what other municipalities contribute with this.
Okay.
Mr. McDonald.
Thank you, Mr. Chairman, for allowing me to speak. I am not on your committee. As a former first responder, I can speak firsthand the importance of this program. I think it's a terrific program. But there's 2 points I'd like to make this evening. One is not that long ago, I was listening to the deputy's scanner, and an interesting to me popped up. A deputy had asked if there's any room at Rosecrans for the person the deputy was speaking with. Dispatcher called back and said the intake wants to know if the person has insurance or not. The deputy replied, no, they don't have insurance. And after that comment was, we don't have any space available. So Mr. Stallings, I don't know your position. I don't know who did that. Maybe they did it improperly, but our level of care shouldn't be based on whether or not an individual has insurance. It should be based on needs. And again, I'm not blaming you. I'm just asking, maybe you could check into that to make sure we are providing the best care we can for everyone, regardless of their situation. Again, I think you have a terrific program. I look forward to not only continuing it, but actually allowing it to grow as well. I'll echo what Mr. Kelly had said earlier in my previous comments. I think this is a terrific program. This may be better funded out of the mental health. Maybe we could talk to them, see when they're expecting funds. Maybe we can loan them the $85,000 and pay us back. But I think this is a terrific example of why the community passed the mental health tax, because they realized that this is a necessity and we need to move forward with this. And maybe that's a good place to look as well. Thank you, Mr. Chairman.
Thank you, Mr. McDonald. Okay, I don't see any other hands. Is there anyone that I can't see that has anything else to add? Seeing none, I'd like to thank Mr. Stallings for taking the time out to join us. I know it takes a special individual, Mr. Stallings, to work in the field that you work in, and I appreciate your patience, your perseverance, and your commitment to this. It means a lot to us. Thank you, sir.
Thank you, Mr. Chairman. Have a good night, everyone.
Mr. Chairman,
Yes, Miss Red.
I'm sorry, it's hard to unmute when you're on the phone. Wanted to say, I can't remember who the person was that said something about Mr. McDonald, I think, insurance. I have had that happen to me, trying to get people into facilities and they don't have insurance and they're turned away. Everyone should be treated, whether they have insurance or not. I just think that's something that we need to look into. If you don't have insurance, you should be offered the same services. Thank you.
Thank you, Miss Red. Mr. Arena, sir.
Thank you, Mr. Chairman. So will this issue be up for a final vote Thursday?
Mr. Chapman, I believe it is. I believe it is up for a final vote because it's already a budgeted item, and
It is on the agenda for Thursday, but you know, what the board chooses to do, it's up to them.
I guess
Right.
I'd just like to get some answers to, in particular, I could understand if the county is paying for county residents and no municipality is contributing, that makes sense. Are we also paying for residents of Boone County to use this service? That would seem odd to me. And, you know, I understand it's a very needed service, but it seems like, and the insurance question is another good question. You know, if it's not necessary to rush it, I'd like to wait, but if it's time sensitive, I understand all.
yeah, good points. Good points. Okay. Well,
May I speak?
yes, Miss Gorel.
I don't know any place where you can go anymore that the first thing they ask you is, do you have insurance? one of the things that the mental health board is going to be looking at is people who fall through the cracks who don't have insurance, so that they aren't turned away. I hope you all got an email from that I had sent out in regards to the campus of Mercy over here on Rockton Avenue. The reason they don't want to take these kind of people anymore is because they don't have insurance, and because they would have to go on Medicare or probably Medicaid, and they don't find it's beneficial. So even your hospitals anymore are turning people away who don't have insurance. This is something that, again, I would like to remind all of you that if you have an opportunity to send me a letter, I'm really upset about what's happening with the Rockton Avenue campus and how they are turning down patients, and they're blaming it on everything else, but it comes down to the fact if you're on Medicaid, Medicare, they don't want you. It's not a money-making thing. And this hospital over here is where we also get the majority of those who are in crisis. We got over here, we get the majority of the gunshot wounds. I think, Aaron, you can kind of back me up on that too, because you know where the people go when they are in an ambulance, for the first place they take them. Now we won't be able to take them anymore to Rockford Memorial. So I would like to ask something from each of you, perhaps an email that I can bring to this meeting, or you come to the meeting and speak on it on Thursday between 2 and 4. So I really would appreciate it, because it's getting to be a problem about insurance anymore. And I understand it, they are in business to make money, but to become, how much money do they have to have that they're turning away those who are on Medicare and Medicaid? Thank you.
Thank you, Ms. Gorel. Any other questions or comments concerning this resolution? Seeing none, hearing none, we do have a motion and a second for the resolution for the Rosecrans triage. We can approve it at committee, and we'll see how it goes at county board. All those in favor for this resolution, say aye.
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 Those opposed? Hearing none, motion carries for the resolution. Next item on the agenda is the towing, the resolution awarding bids for county towing services. Mr. Chapman, this one kind of caught me by surprise a little bit. What bids are we accepting, sir?
I would refer this to Ms. John. She has the information relating to these services that are provided.
All right. Should we get a motion and a second for this first before we go to Ms. Johns? Mr. Fellers?
So moved.
We got a motion by Mr. Fellers. Resolution awarding bids, a second by Ms. Gorel. Discussion. Ms. Johns, what do we have for bids?
Yes, good evening, Chairman. The five, I don't know if it was 4 or 5, it was before I started here, the bid went out for impound towing services. And Chief Barcelona was part of that project, from what I understand. So he reached out to me and asked us to go out for bid again, because our contract was going to be expiring. And so we did that. We went out for bid, but we've expanded it somewhat by offering these optional services. So when a deputy's on the road and he has a flat tire and he's on the highway, he doesn't have to change the tire, because he would just be a target. So those are the things that you'll see on the bottom of the bid tab, such as tire changes, lockouts, jump starts. Those are more for the deputies when those are needed. So we sent the bid out to every local towing service we could find. Our administrative assistant literally called every one of them, because we wanted all our local businesses to have a fair shot at this opportunity, because this is something that can only be handled by a local provider. In the end, we had 2 bidders, A to Z Towing and Haas Towing. And you can see from the prices, they're very, very similar. The county is broken down by the river. So you have section A or section 1 and section 2, and it's basically the river. And the idea is at any site in the county, a tow needs to be able to get there within 30 minutes. That was one of the requirements too. And the other thing is we have a lot of county vehicles that need to be towed. Last year, we averaged over 70 vehicles we had to tow ourselves. These are our cars that are broken down, or cars that are wrecked, or cars that need to go to Greater Rockford Auto Auction. And we have been paying zero to have those towed. Going forward in the new contract, A to Z was our current vendor. They want to charge $50 a tow, which is quite a bit. You go from 0 to 50. But Haas came in at zero for towing the county vehicles. So I left this project was definitely for the Sheriff's Department to make the decision. So Mark Harner, Chief Barcelona, and Tammy Gorel and I all met. And in the end, they decided to award it to both businesses. Some have better prices, some have better storage capacity, which for impounds, when there's a fatality, you have to impound a car maybe up to a year and a half. And Haas has a pretty good facility for that. So that's what we're proposing in this resolution, to award this contract to both vendors. And so when the deputies are out impounding a car, they can call, and whoever can get there first, they can call them, or whoever they're comfortable with. And so that's what we're proposing here. It'll be a 2-year contract with 3 one-year options.
1-year options, okay.
You probably got more than you wanted to know about towing.
So some calls may cost us $50, other calls are costing us $0.
This is for the county-owned vehicles. This contract could almost be titled impound towing. I don't want to say two. I think it's over 1,000 vehicles are impounded every year. Maybe it's like 1,200 vehicles are impounded. And that doesn't cost us anything. A to Z, or now it'll be Haas, charges the car owner. They get charged that rate. But we have to have a contract in place so the deputy knows who to call and can make those arrangements, and then we have insurance on file and things like that. And then we've done background checks on these drivers. But when, at the same time, we have to tow our own vehicles occasionally, and so we are going to have to charge, they will charge us unless we have Haas do the towing, which is what I intend to do for all my towing when I have to have vehicles from vehicle pools towed. So that's the downside. I don't know why A to Z did that, but it's a bid and it's his right. I can't really negotiate it with him when it's a bid. But Chief Barcelona was pretty adamant that he wanted to keep A to Z because his deputies really like working with them. I do want to point out, as far as references, they both had excellent references. Haas does the city impound towing, for example. And I think A to Z does the state police towing. So they both are very, very good companies. And I think we'll do fine having both.
Yes, I agree. Both towing companies were very professional, very efficient, very timely. Way back when I was still on the department, both companies were very good. And I suppose that they would go into the dispatcher's computer screen where they can where they're getting the equal amount, probably alternating on the list. I would imagine.
Well, Chief Barcelona said he would like to leave that up to his deputies to call who they feel comfortable with, but also based on the type of accident it is, type of equipment that's needed, because as you know, sometimes it ends up in a cornfield, in a ditch, in a lake or whatever, and different equipment is needed. And then again, the storage, A to Z does not like to store our fatality impounds, but A to Z is willing to do it. So it just all really depends on the situation. But what I'm going to do, I thought we would type up a document that lists the prices and the contact information for both businesses, and give that to Chief Barcelona for him to distribute it to his dispatchers and for the deputies to have in their cars.
All right, thank you, Ms. Jens. Any questions or
Sure.
concerns? Seeing no questions or concerns, we've got a motion and a second. All those in favor of this resolution, say aye.
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 Any opposed? Hearing none, the resolution passes, and I have one other short, very short item before we adjourn, and that is I received a notification from Chief Saganek that, as I said previously, the feds paid $219,000 to the county. For the month of July, we've received an increase in federal inmates. We are now up to we received $252,000 for the month of August to the county's general fund for the federal inmate incarceration. Any other items that need to be covered for Public Safety Committee? Motion to adjourn. Mr. Fellers and a second by Mr. Arena. All those in favor to adjourn, say aye.
Aye.
Any opposed? Hearing none, we are adjourned. Thank you, everyone, for joining in.
Have a
Thank
good
you.
one.
Thank
Night,
you.
everyone.